Welcome to your favorite program, Healthy Conversations. My name is Pastor Philip Gai, and I am your host for this program. In this program, we talk about nothing but health. All we know is that health is wealth, and you want you to be healthy and at peace and enjoy and live a hopeful life. And today in studio, we have none other than Dr. Hong. He's been our guest here before, and once again he's with us to bring us to speed on matters that pertain to our health. Welcome, Dr. Hong.
Thank you. Happy to be here.
Thank you. Dr. Hong is a consultant physician with many years of experience. He is an IM, internal medicine specialist. He currently serves as the chief medical officer at Kindu Adventist Hospital. This is a level 4 kind of referral hospital that sees many patients every day. And Dr. Hong has certainly seen different types of patients. And today we are talking about diabetes. We started this conversation earlier and we said many things about diabetes, and we still have a lot more to discuss here today. Just to connect with where we left last time, Dr. Hong, tell us about this diabetes. Is there any connection with the hereditary factors in diabetes? Can I have diabetes because my grandfather had it, my father had it? Is it like that?
Yes. So diabetes is hereditary. There's a component of it that is passed along from family members. However, that doesn't mean that you are now completely 100% likely of getting that disease. It just means that you're increased at a risk for it, but we can still make changes so that we can prevent that disease from happening in our own life.
Does this happen for both diabetes type 1 and type 2?
It's more commonly so for diabetes type 2, which is the most common one.
Okay, so you're saying that there's a possibility of being hereditary, but there are also certain things that we can do to avoid acquiring it.
Yes, there is.
So these are what I want you to bring us to speed on. What are the mitigating factors that we could do to save ourselves from actually acquiring diabetes?
So there's many approaches to stopping diabetes. One would be to increase our physical activity. Another would be to change what we're eating, the eating patterns, the eating habits. That just not includes the type of foods we're taking, at what frequency we're taking them, when to take them. So all those things contribute to nutrition. And there's also making sure that we're getting adequate sleep, making sure that we're removing any stressors in our life, that we're abstaining from alcohol, we're abstaining from smoking. So all those things contribute to the overall wellness and prevention of developing diabetes.
Thank you, Dr. Hong. Let's get into a little bit of the details of some of these factors. Talk about health. Talk about exercise. How does exercise come in to help a person to reverse effects of diabetes?
So firstly, exercise helps us so that we can reduce the weight. And reducing weight can really help us to prevent and also reverse diabetes. Another component is that exercise really helps with us decreasing the amount of sugar level in the body. It helps us so that we can utilize those in our muscles, so it's not just sitting around in our fat. Most of the sugars, if we're not using and it accumulates as fat around our body, around our waist, around our organs, those are what contributes primarily to diabetes. But if our activity level is increased, then we can decrease the amount of fat. That decreases the amount of risk of having diabetes.
Does this mean there's a certain amount of exercise that I need to take, like 30 minutes 3 times a week, or just 15 minutes on a daily basis? Is there a specific amount or certain level of intensity of exercise that I need to do to reverse diabetes?
So as doctors, we like to give prescriptions. So some prescriptions we say, take this one tablet 2 times a day for 5 days a week. So we typically say for exercise, this is my exercise prescription. I say exercise at a moderate intensity for at least 30 minutes for at least 5 times a week. So if we're doing that, that's a total of 150 minutes. So this is the minimum that they should be doing. It's not a maximum. Of course, the more exercises, the better. And any exercise is better than no exercise. Studies have even shown that standing as a form of exercise is much more healthier than sitting. Yes.
If I am engaged in an activity that involves physical activity like farming, do I again need to do exercise, or since I've exercised my limb in a certain sense of direction, that should be enough exercise for the day?
So exercise is depending on how much our body works during that activity. So if you're doing leisure farming, such as pulling some weeds or planting, it may not be as as strenuous. So we want the activity level where your heart is able to beat, you're able to sweat, and then you're able to go up to a metabolic rate of activity that's actually expending calories and also really promoting circulation. So it should be something that's really quickening your heart and making it pump well.
Now, if I am already sick with diabetes and you tell me to exercise, do I even have enough energy? Isn't my body already fatigued and at pain? And when I exercise and I'm already suffering from diabetes, am I not only hurting myself even more?
So if you're too sick or you need bed rest, for example, if people who are hospitalized, then it may not be appropriate to do activity. But for people with chronic diabetes, it's best to push through and do some activity so that they can really start on jump road on the road to recovery. As there's an old saying, without pain, there's no gain. So we must push through it and also use that activity so that we can maybe push through and experience some health benefits.
Okay, it might not be intense at that level, but at least some level of exercise.
Yes.
Even if it means walking or something like that.
Yes, even like I said, sitting is not as good. And actually what we're saying is sitting is the new smoking. So we should be standing more and more and try to walk as much as we can.
Thank you. Still staying on matters diabetes, and a lot of these foods, Dr. Hong, could be reversed by diet, as you have said. Tell us more about the dietary factors that could help reverse diabetes.
So as we said, diabetes is caused when there's excess sugar in the blood, and all the food that we intake will ultimately come into our blood. And all our weight is only from the food that we're eating. You know, some people tell me, they say, oh, you know, I've been this big even without eating. And I say, I'm sorry, but that's not possible because the air doesn't have calories, neither is there calories in water. So whatever we ingest, that's what forms the fat in our body, and that's what forms the blood sugar. So I tell them that you want to make good choices of eating food. Rather than eating everything that you can, try to be a bit selective and a bit picky and try to pick things that are whole grains, that are nutritious but also delicious. So a lot of people have a misconception that because I have diabetes, I should stay away from anything that is sweet. But I tell them, I say, God has made this for you to enjoy, to eat, and it's delicious but also nutritious. So you should not be afraid of eating fruits as long as you're eating the whole fruit with all the fiber, with the skins, that you don't just squeeze the juice and just drink the juice alone. So if you eat the whole grain and you eat the whole food, then it also has a lot of healthful benefits.
So I can still be diabetic and eat some of these sweet fruits and still enjoy vibrant health with that without any problem?
Yes, the problem is not the sweet foods. The problem is the processed and refined foods, such as the sodas we're drinking, the cookies that we're eating, the cakes, the mandazis, the chapatis, the refined foods. So if we were to replace those things with abundant fruits, abundant vegetables, grains, then our diabetes wouldn't be a problem that we would need to discuss.
Thank you. So Dr. Hong, when a patient comes to your clinic and they're diagnosed with diabetes, what are the prescriptive cures that are commonly found around with such situations?
So typically we start them on some medications. Some medicines will force their body to increase more insulin. That will help lower the blood sugars, and some of them will help make the insulin a little bit more sensitive so that they're more effective. And those are tablets that people usually take. But I always also prescribe them in addition to drugs. I also prescribe them with a lifestyle prescription. So that includes eating whole grains, eating fruits and vegetables, exercising, reducing the weight. And if they do those things simultaneously together, then the sugars will come down, and eventually we're hoping for that their sugars will go away, that the diabetes will go away, that they'll stop taking the medicines.
Coming to the prescriptive drugs for diabetes, would they have some side effects that these patients need to watch on if they're taking diabetes drugs?
So the most dangerous side effect that they would be worrisome is that it causes the sugar to go too low. That if they end up taking the medicine and it's too strong for them, it may cause their sugars to plummet and sink. And in those cases, it would be very dangerous because our body cannot survive without any glucose at all.
Now, you talked about lifestyle changes that they need to make, like exercise, eating the right amount, and sleeping well. Some people, just because of fear of the side effects of drugs, choose not to take prescriptive medication and would want to reverse diabetes with some of these other aspects. How would that work? Would that be equally effective?
So I always use a modular approach when I'm treating a patient. because I don't expect everything to be working. I don't put all my eggs in one basket, as they say. So I try to spread the different types of treatment modalities around, because I'm expecting that if this one doesn't work 100%, that it can be augmented by this other way. So I always try to take into approach the whole body consideration. Of course, the best scenario is that they're not dependent on drugs anymore, but when they're first diagnosed and if they're very sick and hospitalized, it may be difficult for us to achieve those health changes without first starting them on medicine to lower the sugars while we're providing the education and support that they need.
So you use a multifaceted approach to this.
Yes, yes. With everything, I think it's important to address all the needs of the patient. You know, if I just, when they're first diagnosed with a disease, it's very overwhelming, and having to first cope with that illness and then also make all these changes can be very stressful for the patient. So I first try to counsel them through it, and all patients who are diabetic, when they're diagnosed with a chronic illness, they should receive counseling.
Okay. Now, we have, earlier on, you talked about these issues of diabetes and certain level limbs having to be cut off. What is it that precipitates the situation where someone's limb has to be cut off because of diabetes?
So diabetes causes two things in the legs. So as you know, the legs are the furthest part of our body that's away from our heart, which means that the heart has to work extra hard to send blood to that area, all the way down to our toes. So that not only speaks to the circulation, but also the conduction of our nerves. So that means the sensation. So diabetes is not only does it affect the big vessels, which means the big channels which are carrying blood away from the heart, but also the small, small, tiny vessels. So when those small, small, tiny vessels are damaged, there's poor circulation in the feet, and then they feel some pain. And that it can be caused from the nerve damage, and we call that neuropathy, which means nerve problem or nerve disease. And they feel some burning sensation in their feet. They feel like there's some small prickling needles that are in their feet, and they also later lose the sensation of feeling cold and heat. So when that happens, any small injury on their foot, like when they're walking and they step on something sharp, it can cause a prick or it can cause a wound that can later develop into an overwhelming infection that leads to be uncontrolled.
One of the things that I see with the people suffering diabetes is the issues to deal with wounds. I've seen some doctors ask people to be very careful not to have any wounds. And if they have wounds and they have diabetes, they have to take care of them in a certain way. What did you say about wounds and diabetes?
So when people have diabetes, the sugars are high, that really inhibits the wound from healing well. In order for the wound to heal well, there needs to be very good oxygenation to that area, vital nutrients that's supplied by our blood. But when the sugars in the blood are high, it really impairs the wound healing process. So after surgery, after any kind of procedure, and after any kind of wounds, they're very difficult to heal if the sugars are high. So we also tell them to be vigilant that if you have a wound, make sure that you take good care of your sugars so that the wound can heal. But if you don't have a wound, please prevent yourself from having a wound. So make sure you look under your feet every day and make sure there's no cut, no scrape. Because patient with diabetic may not be able to sense the wounds already. They're having decreased sensation. So they should check their feet, they should check their limbs to make sure that there's no wounds.
Now, I've actually seen some people devise some special types of socks for diabetics, which are soft and just does not prick the body. Is this something that is very common?
Yes, so there are different types of devices. There's also devices to help assist them so that they can pull their socks up if they're not able to, and helping some walking assistant and those aids as well.
Thank you so much, Dr. Hong. You're watching Healthy Conversations, and I am Pastor Philip Gai, your host for this program. And today we're just discussing diabetes, and we have Dr. Hong, who is a consultant physician, and is bringing us to speed, bring us to awareness on matters diabetes. It's good for you to know, it's good for me to know, it's good for us to make the right choices as far as our health is concerned. Now, Dr. Hong, you earlier on mentioned about our eyes with effect to diabetes, and sometimes this can lead to blindness. How does that come about?
Yes, so it's similar with our nerves and the blood vessels in our feet. So the nerves and the blood vessels inside the eyes are very delicate, they're very thin, and when the sugars are high, it can lead to damage and lead to leaking of the blood and leaking of the sugars in the surrounding area. And the sugars are very inflammatory, and they provide swelling in that area, and the bleeding can eventually lead to chronic damage in our eyes. And then we have blurry vision, and then eventually we have blindness. and some of the blindness is irreversible.
Thank you. Thank you. Now, earlier on, we had talked about diet. And there are some people who have certain conceptions that if you fast, your body retains some certain levels of sugar, and this might be worse for someone who is diabetic. What did you say about fasting in between, levels of eating as a diabetic? Is this something that is good, something that you would recommend, or something that would be disastrous to this patient?
So it depends on if the patient is on drug therapy. If they're taking drugs that really decrease the amount of sugar, they should be careful if they're fasting for too long. Because sometimes if they're fasting while taking very strong drugs, it can make the sugars too low. However, fasting in general is good because it reduces the amount of insulin that's being secreted at all times. So something that we need to talk about when we're discussing matters of nutrition is the eating habits. There's also need to talk about frequency and interval of eating and when to eat and how much to eat. We've talked about what to eat, and hopefully I think the viewers may be able to be aware of the whole grains are the best grains, whether whole foods are the best foods. But there's also an importance of when to eat and how much to eat. So the most important meal of the day is called breakfast because after a long period of fasting overnight, you want to break the fast. And that's why it's called breakfast. You're breaking a fast overnight. So it's important that when we break our fast, we're breaking it appropriately with the correct foods that we're eating for that day because that really boosts our metabolism and gets us ready for the day ahead. Yes. So it's okay to actually have a prolonged fast in the evening because during the nighttime when we're sleeping, our stomachs should be emptying because our body is resting, and you cannot rest well if your stomach is full of food. So we want to make sure that they're not only choosing the correct foods to eat, but that they're also eating at the appropriate times, at the appropriate intervals, and the appropriate frequency.
And that reminds me of this saying that you eat breakfast like a king, you take lunch like a prince, and you take dinner like a pauper or not take it at all. Some people actually think that this is not possible. You wake up in the morning and you're just not hungry. You don't feel like taking that big meal for breakfast. How do you go about that?
I assure you that if you eat dinner or supper like a beggar, you'll be able to eat breakfast like a king. It's because we have eaten supper already like a king that we're no longer hungry in the morning. Yes.
You talked about timing. When is the correct, or rather the best time to eat the last meal of the day?
So the best time is to eat it no less than 3 hours before sleeping. So if you're planning on resting at 9 p.m., then you should be taking your meal no later than 6 p.m. That way it gives ample time for the body to digest, to fully get rid of all the foods in your stomach so that you can be able to have a good night's rest.
So whatever time you're going to sleep, you should take this last meal like 3 hours before that time.
Yes.
Oh, that's amazing. That's very important. Talking about those curative measures that you talked about, whether it's medication, is it possible to completely reverse this diabetes so that it's no longer there? Let me say for a long period of time.
Yes. So I tell my patients, you're not born a diabetic. You're not born with this disease. So because you were not born with this, and you didn't acquire it from when you were a young child and you're not type 1, this is a reason why you can also reverse it. A lot of this came about because of our improper diet practices and our improper health practices. So if we were able to do the proper way and do it the right way, then we can also get rid of this disease, which was never intended for our bodies to begin with.
Now, something else that bothers me is how this person who has been diagnosed with diabetes is going to get support, either social support from the family or support from the place of work, from colleagues, from friends. What kind of support do diabetics need in the environment where they come from in order to thrive, in order to be happy and hopeful and live healthy lives?
They need support from every aspect. I think first they need understanding from their family. When a person is diagnosed with diabetes, radical changes must be made. In addition, that they now must set aside funds so that they can purchase the medications, they can go for clinic visits, laboratory testing. They must also change their food patterns of what they're buying. And as in our family structure, we usually eat together. So when they're eating together, they must be able to eat of the same foods, and usually we have to change the entire family's meal and their palate of what they're going to be fed. So I think that requires a lot of understanding on the family and support. But it also requires mutual understanding and support from our community too. Because this is somebody who has a chronic illness who we must also support and we must be understanding of. So if we know that this food is not good for them, we know that we shouldn't be giving them all this oily fried foods or this meat intake, then we should be considerate and not offer those things to them as a temptation. So I think all those things we must be considerate of and consider when we consider the health of that individual.
And so if this food is not very palatable to me, and because I live with this person within the family, I need to be accommodative enough to just continue partaking of it, even if it's not palatable to me.
It's also you're investing in your own health. And I think that when you're prioritizing the healthy diet, even if you're not sick, it will prevent you from getting that. As we said, that this can be a hereditary disease, and largely so because usually families eat the same things.
Okay.
So even if I'm not passing down the gene to my children, if I'm feeding them the same food that's causing my disease, I should be expecting the same disease in them as well, isn't it?
That's amazing. Now tell me, Dr. Hong, you've certainly seen so many patients in Kenya, in other countries in Africa, Rwanda, where you also worked, and also in the United States. Are there certain conceptions or misconceptions that people have towards diabetes as a disease that we probably need to demystify or bring clarity on that you may have come across?
I think that there's a strong push that people think that sugar is good for you, that they really advocate for sugar because it boosts our energy and gives us strength. This is a misconception because, food it is that gives us strength. It's not the sugar that gives us the strength. So people take soda or they're used to taking glucose. But what we derive our energy from is nutrition and the nutrients. And in addition to just sugar, in addition to sugary things, there's so many more benefits in a whole grain, even if it's like a piece of fruit. There's all these vitamins, there's all these minerals, there's all these other things, chemicals, phytochemicals that we cannot even begin to understand. So I think limiting into such simple terms as this is sugary, so it's bad, this is sugary, it leads to this, or this is sugary, it's good for you. I think that's a thing that we must debunk. That, it's not just about sugar content, but about the whole grain in the food. When people ask me, they say, this has so much sugar, how can I eat this? And I said, don't think about sugar, just think about the food itself. We're not eating sugar, but we're eating a mango. We're not eating sugar, we're eating a papaya, we're eating, a sweet potato, this, that. Instead of focusing on the specific food group, we focus on the actual food itself.
Now, I'm looking at the thousands of patients that you're seeing at Kindu Adventist Hospital and maybe thousands of others that visit many other hospitals with diabetes as a challenge that they have to go through. What's your take? Is the government doing enough? Are hospitals doing enough? Are private facilities doing enough to mitigate the issue of diabetes? Or is there something else that is yet to be done to reverse the impact or effect of diabetes across our families and in the ecosystem, in the community where people live?
I think that a lot of efforts have been made on the church level, on the government level, the hospital levels, the community. However, because this disease is rampant and getting out of control, it's just really difficult. I think of it as an epidemic, as when the COVID outbreak was hitting. Of course, they were doing as much as they can to prevent this disease from spreading and controlling, but it's just become so common and so common. And I think if we really want to address these issues, we as a hospital worker, we as a church, we as a government, we need to address the core causes. We need to really help people so that they don't have access to such refined foods, oily foods, that we give them access to healthy, nutritious things. We should help subsidize so that those things are readily available and maybe take out some of those things which are not helpful and really incorporate exercise in the workplace, in the community, and promote these healthy behaviors.
Now, I listen to you and I find it very unfortunate that the actual things that you're telling us to eliminate are the ones that are actually being promoted largely. You are earlier on talked about smoking and drinking alcohol and refined foods and the kind of sugars that people think give energy. Those are the ones that are being promoted, and it's a bleak picture. It's painful to see that. I don't know. What do you think?
I think if we have some people who are in health policy, who are motivated, and they realize the importance and impact of this change, they can make a profound difference. It just takes a few people to make a profound difference in our community and in our economy, or even in the nation as a whole. But we need to tap into those people and really, I hope they're listening so that you can see exactly what's the impact of this financially, economically, globally, so that they can really realize how we can best treat this illness. Because ultimately, we want our citizens to live very long. We want them to live very happily. We want them so that they can have a fruitful and robustful life. And the only way they can do that is if they're free from disease.
And some of these people could be the influencers. They could be the pace setters. They could be the people who will lead in the right direction, and others will just tag along and follow them in a correct or healthy lifestyle, making right choices, and others will follow them along. And that would really be good for the families and also for the society. Now, Dr. Hong, you actually said that this disease, diabetes, could be leading to pandemic proportions, just like we had COVID and others. And that's a very bleak picture. Could you give us some hope? Is there some little light at the end of the tunnel that this diabetes menace could be tackled and, to a large scale, reversed for the betterment of society? Where is this hope?
So the hope is in providing education and resources. So as people are aware of the consequences and as they are aware of all the different complications of the illness, and I think that helps waken them up. Knowledge is really power. And as we give these people, the viewers, as we give each one of them information, as we impart to them all the resources about how to reverse the illness, how so that they can prevent this illness, I believe that we can really, really help by making a step toward that way.
And what would happen once this step is made on a larger level or on a macro level and diabetes is being reversed? Can you just paint that picture for us?
I would love to see that the hospitals no longer have to deal with these, that our dialysis patients are decreasing, that we're promoting health and improving community health for all. So that would be the best picture, is if we have fewer patients coming in and out of the hospital, that they're staying at home because they're being well, that they're living a healthy life, free from disease, not going to dispensaries. That's what I would like to see.
Oh, thank you. Thank you so much, Dr. Hong. This is Healthy Conversations, and we're just tackling one disease at a time. Just bring you to speed, creating awareness so that we may make the right choices in life. And as Dr. Hong has correctly put it, we look forward to the time when we'll have fewer patients in the hospital, greater numbers in our populations being healthy and strong and happy. And that's our prayer for you. That's our wish for you. So I am your host for this program, Philip Gai, and I'm looking forward to seeing you again in the next episode of Healthy Conversations. Keep it right here. Hope Channel. Wish you God's blessings as we move forward. Thank you so much.